not stop in the middle. Okay, so you must wonder what either number 3 is, right? Okay. Number 3, as what I can say and I would vote for, is the noise. So when the patients come to the office, it is, like a lot of people scared because of the noise too, and hate it because of the noise. So just imagine that when you hear some loud noise outside, right? You already feel it's so loud, right? But just imagine what happened in your mouth. It's just here and here next to your ear, and your ear gonna send signal to your brain, so it did so fast, like next to each other, like here. So of course the sound will amplify so many times compared to the sound from outside, right? So when it's amplified like that, then basically it's bother patient a lot. So normal noise is fine, but for me, before I become a dentist, I personally hate the noise of scraping calculus, or like black, or like build up from tooth when they do the scaling, root planing, or deep cleaning. I hate it, like oh my god, it just it's so annoying, and it's so noisy, and I hate that sound, because it makes me feel like goosebump. But then when I go to dental school, and my teacher is saying that whenever you hear that sort of sound, it means that something coming off your mouth, right? And I was like, so that a good sound then, right? Because if whenever I hear it, I know that I'm taking something off the patient's mouth, something dirty, something not good for patient out of the mouth. So then I feel like, ooh, I do something good happened here, right? So when something happened, I should feel good. So I change my perspective about the sound of the noise, and then it make me think about it as a good sound instead of a bad sound in the past. So because of that, I feel better whenever I hear that noise. I'm like, oh yeah, instead of so it just basically help a lot. And then I share the story with the patient, so patient feel better, right? Because I know every single time that thing come off their mouth, is they feel good. So they evaluate me how many times they hear that sound. So it make it more fun for them. And so that's the thing. So how to deal with that? So for the noise, I usually ask the patients to bring their own music or earphone, or basically in the office we might have the earphone for them and give it to them. So when we give it to them, basically we tell them to listen during there, and then if anything happen or they want to talk to me, or when I talk to them, I kind of signal them so they can show my hand or something, so they know that I'm talking to them because I on the earphone. So that will help with the noise. I mean, not 100%, but it does help with the noise. I'm sorry about the music again, in the neighborhood. So stuff like that. So that is about the noise thingy. The fourth thing I want to talk about is why people are scared of dentists is because they don't know what happened. They don't know what gonna happen. Okay, so that is, and they don't see what happened. You see what I mean? So basically, let's say I'm gonna do nail, or I'm gonna do hair, or do makeup, or do anything. I can see it, right? Or I go to the service, I get a haircut. I know they cut to here, this level. They not cut to this level. Like, oh please, don't touch it. It's only 1 inch from here. I only want here. I don't want it on here, right? Right? You order them what to do, you show them like, oh, what they want, and see it. And when they do it, you see it, and they stop them from doing it, right? Here now is when you come to dentist, is the different story. You are not like a customer. That's why people say that like you are patient. Be patient. Like you're not a customer, and you are patient, and that's why you need to be patient, and that's why the doctor need to be patient with you as well. So when you come to the dentist, right? Guess what? You don't see what I'm doing. Let's say I drill your teeth, I do veneer, I do crown, I do extraction. Will you see it? No, because in your mouth, right here, in your eye right here, you look down. I mean, you try your best, but you can't really reach it, right? So when basically, unless you have a mirror, well, I'm not. My assistant not gonna hand a mirror to you unless I'm done with the procedure, or unless you have a special request, right? But usually not. Okay, so you're not gonna see anything happening. So that's why it's scary. It's like you walk it into the dark, in the dark, and like you don't like blindly going everywhere. You on the corner, you don't know where a good thing, you don't know where to go, you don't know what happened, position everything, right? So that's why you're scared, because you say, oh, I don't know if she do the good job. Oh, I don't know if she do a bad job. Oh, I don't know if she do anything harmful to me. If they don't trust the dentist. But if they do trust the dentist, it's a different story. Because basically a lot of my patients give me a compliment by snoring in my chair, which is they come to my office, I'm working with them, and then they're snoring because they're sleeping, and that's how comfortable they are. So usually I was joking with them like, oh, that's the way you compliment me, huh? So they say, yeah. And so I was, that's the thing. The second thing is basically a lot of dentists, they just do their work, right? They just do. They don't explain to the patient like, okay, I do number 1, number 2, number 3, number 4, number 5, blah, 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 right? Or what I gonna do next. So the patient don't know like, okay, what next? What she gonna do next? What this and what that, right? So what I do to my patient is basically I explain before I do the procedure. I sit down with patient, do the exam, and then come up with the treatment plan. After come up with the treatment plan, I explain the treatment plan. What gonna be in treatment plan? What procedure I gonna do, right? So after the procedure I'm gonna do, then let's say today I'm doing the root canal. I would like, okay, patient, I will send the patient the link about the root canal, or I will explain to the patient about the root canal, what it is, what the pro and con, what you're gonna do, when you're gonna do, when you don't do, should you save it, all that, right? And the patient know about root canal. Then I tell them the procedure, like how I gonna do the root canal step by step, okay? Then the day that when they come to the dental office for the root canal, I will basically say like, okay, measure blood pressure, whatever, patient sit down, lay down on the chair, and then I will like, okay, I'm gonna do the instructions. Then next, I'm gonna drill the tube. I'm about to blow some air for you. I'm about to suction, like my dental assistant about to suction some liquid in your mouth. There are gonna be a lot of water, okay? So a lot of signal, a lot of a lot of talk along the way, so the patient know what's going on right now, what's going on next. So they not blindly go through it, but they know about it, and they understand about it. They know what is going on with their body. They know what's going on with their teeth. Okay, so I would say, okay, so next, like, what you're gonna do with, okay, I about to rinse your tube, clean it. I about to feel the tube. I about to check the X-ray for you. And after we're done with the X-ray, we're gonna polish your teeth, let's say. When after we done, then polish the teeth, then give the mirror for the patient to see, like, oh, if you do a filling or something, give the patient see it. Patient happy, then dismiss the patient and they say, okay, so you are done. Like right now, after that, you can be done. So basically, my patient know exactly what is going on and exactly what is going on next. Okay, and let's say next appointment they're gonna come back to see me with another procedure, then I will send them another link, and then we say, like, okay, next time we're gonna do this, you need to come back for this procedure. Then they know, right? So I mean, that thing is really important, because you know why? The more you tell the patient about what you're doing, they actually follow it and they understand, and they know that, oh, where they are. So they know, like, oh, I'm almost done, or I'm done with this step, I'm done with this step, so I'm almost done. And then especially it helps patient trust you more too, because they know that you know what you are doing, and then they also know that you care for them. That's a very important thing. And then you are there to help them, not to harm them, and they know that that you care, that they will be fear of a dentist, and you try to make them to feel as comfortable as I can during the appointment. So that is very important thing to do. And you know, a lot of patients that when after I see them the first time they done with the procedure, they just come to me and say with me, you know, I say something. I tell them to basically, like, oh, go brush your teeth 2 times a day, floss every single day, or tell them this and that, and they will, like, you know, don't worry, doc, I will follow the instructions because I trust you. And then, you know, like, the word I trust you is really valuable to me. You know, like, you don't know how much it's meaningful to me, because it's even more meaningful than the word thank you or appreciate to me, because it's so hard to earn someone trust, you know. And once you earn it, it's make everything easier, because basically you can do anything, right? Like my patients say, like, I trust you, you do whatever you want. I'm like, well, of course I will do whatever I want in my ability, and in the way that I would not harm my patient. That sure, I would do it, you know, in whatever I want. But you feel so good that way, because why? They trust you. And then whenever you do anything, they don't judge you much anymore, they don't judge you anymore, so you just go ahead and do it, and you feel better because you don't feel pressure that much anymore, and you do a better work as well that way too. So you know, it's also not only help the patient, it's also help me as a provider. So you know, that's the you know, the 4 thing that we talk about, like, you don't know what's going on in the mouth. So I think I cover on the fear that actually I want to mention about. I know that is a lot more than that, but then to what I know, or to what I think that is most important to cover to topic, because I cannot keep talking a lot of things or all of the thing of the fear of dental. But so I will be summarize or condense it in a several important point that I need to cover with you guys. But basically it's just you know, basically it's in summary, then you know, the fear of dental, what we should do is mention your fear with the doctor. The dentist, like, should like you should bring your music with you, like your earphone with you, and then change the perspective about the sound in dental. And then don't think about, like, oh, one dentist is you know, like, bad, then every dentist is bad. It's not like that, you know. It's one person doesn't say everything about all. So you need to find trust again in someone else. If you lose trust, then Very important thing that I advise you as a patient, that basically you have to research a lot about, especially when you are scared of dentists, right, and have a bad experience. You need to do a lot of research about the dentist that you're gonna do in future. Okay, so now the technologies, everything is developed, really fast and everything. So now you can see everything in Google, like everything, Google review, Facebook review, Amazon review, everything review, right? So almost 100% of the patient come to my office, and I ask, like, how do you hear about us? They say Google review. So or once in a while I say, oh, friend, but most of the time Google review. So you can go ahead and read on the Google review and 5-star review, all that, and then choose for you. Please find a good dentist. That is make everything different, right? So if you find a good dentist and someone you can trust, it will help with your like psychology too. And then when you come there and you mention your fear and everything, and they will help you, and then they put you in good shape, and then you will feel better, right? About dentists, what we can do to help the patient is basically make the patient sit down with the patients and talk more, about their fear, and analyze and everything, and then come up with a way to make the patient overcome it. Second thing, to be more gentle. Third thing, basically explain with patient every single step you do, tell them every single step you do about to do, and then during the injection, make sure that it's nice and easy. Do it slowly, count down, do on that step. And when you are in the a assure with the patient on the step that you go through, and that will help a lot. So I think I covered enough for today, and I I'm hope I hope that you guys enjoy my conversations and enjoy my discussions and my share, the way I share about dentistry, and why I say this first, or put this topic the number one first in my video that series of the video that I'm gonna do, is because I want to make sure that my patient, when they come to me, they face their fear. They will try to overcome the fear with me, as well as other patient of another dentist that not my patients. When they about to come to their office, they know it, and then they will try to feel better about dental. My goal or my dream in future is patient would not be scared of me as a dentist at all. Well, I know it would be hard, but I think there's nothing impossible, right? First, I would do me first, because a lot of patients, when I come to my practice, I ask them, like, are you scared of me as a dentist? They say, like, yeah, I'm so scared. But then when I'm done, I say, like, are you still scared of dentists? Or scared of me? Say, no more. Like, say, I feel much better. This is one of the best experience I ever had. So stop like that. It just like light up your day and make you feel much better. Because why? Like, at the end of the day, you will ask yourself, oh, what you do, in this career, like, is you do this is to earn a living or not? Like, well, of course I do dentistry because I have to earn a living, because I need money to live, right? I need money to help my family and everything, of course. But I mean, behind that thing is what is the reason why I want to become a dentist? What is my passions about it? Is it actually my passion about dentistry? Like, I want to make people feel better. I want to make people feel happy. I want to make people feel have a beautiful smile. As I say in other people, I'm with other people. I say that what should I say this? Oh yeah. So I believe everyone is more beautiful when they smile, even with or without teeth. Of course, I prefer teeth because I am a dentist, right? Because I think that everyone's smiling when the smile looks better. But my goal is to make everyone smile beautifully with teeth. And I hope that my passion in dentistry would carry on. That for sure, as long as I am a dentist, and I would like to help as much people as I want. And that is my philosophy of life. So I just want people to be happy. So thank you so much for watching my video. I know it's a long video, but thank you so much for watching. Like, if you like the video, please like and subscribe down below, and comment for me and share to other people so they will know about the fear of dentistry and how people who fear of dentistry, it's just, you think that is you don't think about it, but it's just like your 1 minute, not 1 minute, 1 second that you click the share to people, then they know this about this video. They might change, it might change the way they think about dentistry, and they make they not fear of dentistry as much. So if you really have friends and family that you care, please share this video, and I would love it to have as more people that know about this video and know about this, so we can be together. Like, we help you guys, like we as a dentist help you as a patient to overcome your fear of a dentist. And my dream is to basically even bigger, that in future the patient will not scare of any dentist at all, which is hard, but at least me myself first. Thank you so much again. And I will I actually have I have a gift. So at the end of the video, I only have a gift for people who basically can comment down below for me anything that any suggestions that I can do, that you give it to me, so I or other dentists can do to make dentistry easier, and something not too fancy, but something like more efficient, or any idea that is make dentistry better. If so, you can comment below, and anyone who say it, like who had the best idea, I would pick that person, and then I will give you a gift. So a gift for today is a bracelet. It's just like a stone that is pretty cute and nice, blue stone. So you can just wear it like this, and on your wrist. It looks really nice. So, and it's stretchable, so it fit a lot of people's size, I guess. So if you are the one who comment the most, the suggestions, the best suggestion, I will send this or mail this in the mail for you. Thank you for watching.